that. So you're right. When you look back at the other outbreaks, they had spikes, and then sort of they tail off once the outbreak was over, and sort of the interest went down. We're just seeing such an extreme spike. This spike is obviously bigger than anything we've ever seen in both in the world as well as in the research. So the size and the magnitude of the research activity and brain power going to COVID is showing that exact effect, and which is said similar to what we've seen in the other outbreaks or near outbreaks we've had in the past decade.
Well, to your point, though, there is something unprecedented about this scale. I mean, has this ever been done before to this extent, this kind of turtling, basically, of scientific research?
I can't say we looked directly at that, but based on all the research and the work we've done over the past 10, 20 years, no. This is by far the most extreme, turtling is an interesting word, but the most extreme concentration of effort in one topic we've ever seen.
What are some of the consequences then, if you have that kind of tunnel vision? I mean, what does that do? What does that do when you're making these kind of ethical trade-offs about mortality for one virus against mortality for another? I mean, is it a simple problem?
There's a significant amount of trade-offs that some are obvious and some aren't obvious. And I don't think the trade-off is always as overly conscious. It's, hey, we have a major issue now. Everyone go solve the problem. Is essentially what we're seeing happen. Obviously, what that means is brain power that was previously working on other diseases has now been pulled away. So now, progress for some other disease could be delayed 6, 12, even more months, and the delay is the reason for that delay is sort of 2 or 3-fold. The first is obviously there's the time researchers spend going and focusing on coronavirus is time taking away from focusing on another disease. That causes, for sometimes it's as simple as, all right, you took 4 months away and then you're back. But a lot of times research is sort of, once you stop, you gotta get it restarted so that it actually is going to be a longer period to come back than even the amount of time they delayed. I think perhaps more concerning is just the research budget. All the money that is now funneling towards coronavirus and related research it will no longer be available. We're absorbing all the research budgets will no longer be available for a lot of other diseases. So now you're taking this risk of everyone's, almost a 8-year-olds playing soccer. Everyone's rushing to solve coronavirus, and the rest of science is taking a long pause. And once we're over the coronavirus habit, we're going to realize that we have millions of patients looking for, still struggling with other diseases that are now going to be delayed 3 to 9, 12 months at a minimum.